I'll pass it off to Commissioner Miller for a Texas Ag update.
Well, thank you, Dr. Ronny. I'll tell you what, sometimes there's divine intervention. You seems like you're the man for this time. So we appreciate your interest in running for this office, and we're glad to have you there, and you're going to make a wonderful congressman. So glad to support you. Texas Department of Agriculture, you might wonder what we would have to do with the virus. Well, I am the Commissioner of Agriculture, but I'm also the Commissioner of about 130 other functions that we do. I'm also the Commissioner of Food and Nutrition. I'm Commissioner of the State Office of Rural Health Care, and I'm going to talk to you a little bit about that. As a state official in a state department, we're part of the State Operations Center. That's where our emergency management is run out of. All the agencies usually have someone there, so we're working there. And just to give you a statewide update, we got another 2.5 million masks this week. That puts us up over 3 million. By the 11th, we'll have 3 million more. Our hospital capacity is at 140% if we need it. Hopefully we will not need it. Statewide, 7,276 cases, and it can be found in 157 counties. So there's still about 100 counties where we do not have a case. Unfortunately, there's been 140 deaths. The bright spot on that, a couple of bright spots actually, per capita deaths, we're one of the lowest. We were the lowest in the nation. I don't know if we still are or not. I didn't have time to check the numbers. But maybe you hadn't thought about this. Abortion clinics were considered an elective surgery. A judge overruled us on that, and then the circuit court overruled him. So the abortion clinics are closed. So this virus has saved 10 times more babies than victims have fallen, to it. So just food for thought. Let's first talk about food nutrition. I'm responsible when school's in session for feeding about 5 million school meals each day and overseeing that program. We'll continue to feed those school kids. I've had to ask for a lot of waivers. I've gotten 11 of them so far. We've switched to not feeding necessarily at the school in the lunchroom, but we're having people grabbing what we call grab and go, pick up lunches and go. Under the set of rules, the child had to be present with the parent or guardian. I've put a waiver in for that. I've got that through. I also put in another waiver to let the parent or guardian pick up multiple meals so they don't have to come twice a day, 5-6 days a week. Another waiver to allow schools to feed those children on the weekends. We don't reimburse for that, but if they want to do that, they can. Otherwise, before the waiver, they could not. If you want to find a meal pickup place, you can go to our website, texasagriculture.gov, and click on squaremeals.org, and it shows you all the places across the state where those feeding centers are. Many of them are the same feeding centers that we run for our summer feeding program. We're working real close with our area food banks. There's 21 across the state. They're running out of food. They've been pressured, so I've asked for at least 22 more truckloads of commodities to come to Texas so we can get to those area food banks. Those are on the way. I've got the federal government to back off the Michelle Obama nutritional standards. So we can't always get what we want. For instance, right now we're supposed to only serve 1% milk. The dairies are only supplying whole milk. They can't keep up. So they're not even making 1% milk. So now this allows us, if you can't get 1%, we're going to be able to serve the whole milk, which I think they should be serving anyway. We had to ask for a waiver for eggs. Everybody's short on eggs, but we had eggs running out our ears, but they were packaged for bakeries and restaurants and hotel chains and cruise ships, so they weren't labeled according to the law. So we got that in. So if you can't find eggs, call your local restaurant. They can actually now sell you eggs and a lot of other stuff that they have there that they would have made or bakery shop or something like that. So if you're having trouble finding that, check with those places. An interesting one that came up, we have a lot of warehouses full of toilet paper here that we could not sell in our stores because it was all in Spanish, and our laws require that the instructions and directions all be printed in English. Well, everybody knows how to use toilet paper. We don't need those instructions in English. So I got a waiver on that, so now if you see some Spanish-labeled toilet paper in there, you know how it got there. Rural hospitals are really, actually they were struggling before this virus hit us. Several reasons, and Dr. Ronny, he knows all about this, that we have the highest incidence of uninsured in rural Texas. We have the most elderly population in rural Texas, and we have the most dangerous occupations in rural Texas. And for all those reasons, and we have the lowest reimbursement rates from the Affordable Health Care Act. So we continue to lose hospitals across Texas, and this has really compounded it. We have 162 rural hospitals. A little over 60 of them have less than 2 weeks cash on hand to stay open. So we've been hustling to try to keep those hospitals open. We've asked the governor 19 days ago for $40 million so I could distribute to these rural hospitals to keep the doors open. I've yet to hear back from him, but I have been working with the USDA, and I've got good news there. We got about $14 million allocated for Texas. That'll be about $90,000 per rural hospital. We're opening applications for that now, and we move pretty fast. We don't necessarily move at the speed of government at the Texas Department of Agriculture, so we'll get that out the door. These 3 million masks, I've converted some of my field staff, inspectors mainly, that have the trucks. We're delivering those and personal protection equipment to these rural hospitals, first responders, Council of Governments all across the state. So we're pitching in and doing that. I've actually pulled some inspectors off, and now they're inspecting the N95 masks, Dr. Ronny. Believe it or not, we had a huge shipment come into the state, and they were counterfeit. They wouldn't have protected anybody from the virus. So, unfortunately, we have unscrupulous people trying to take advantage of a dire situation. So now, instead of inspecting pesticides and scales and other things, we're inspecting those N95 masks and make sure they're not, counterfeit. These rural hospitals, we think that we can get them propped up and keep them from going under. I continue to fight metropolitan counties and cities that want to shut our agriculture operations down. They just don't get it. So I have made a travel certificate, a travel manifest, whatever you want to call it, a worker permit. If you know someone that's experiencing that, or if you just want to have one just in case, you can go to our website, texasagriculture.gov, click on the coronavirus, and scroll down and print you one off and put it in your truck or in your billfold or your purse or wherever you think it'd be most handy. Agriculture was declared an essential service by the federal government and the state government. So if you're involved in agriculture, and that includes nurseries and florists and people that, we're keeping the sale barns open, but we're using social distancing and some cowboy logic so we don't infest people. If you want to find out more about what your agriculture department is doing, you can go to our website, and I'll give that to you again, texasagriculture.gov, and click on the coronavirus updates. So with that, I'm real anxious to take some questions, Dr. Ronny, and see what we can do for these fine people.